long time since I've went live on my personal page. I just want to make sure I'm in the right spot. I've got, okay, I am. I've got, if you're on, come say hi. Tell me where you're calling. Yeah, where are you calling from? Where you're watching from. I have a lot to share with you guys this morning. I have a couple of doctor's appointments today, so I wanted to go ahead and get this out of the way because today is actually Breast Implant Illness Awareness Day. My 1 year post Explant anniversary was in January, and I haven't shared a update as of yet, and so I wanted to come on and share that. I'm also gonna take off my nail polish. If you guys haven't been watching or know of me, maybe I've got some new friends here. Tell you a little bit about me. I'm a mom of 4, military spouse, and I work from home with an amazing company. And I got really sick in 2018 and couldn't figure things out for the longest time. And so I kind of shared that journey, what I was going through it. I actually noticed it in 2018 after my company's conference. I went and spoke about my situation, what was happening, or not my situation, what was happening. I was training. I was actually a scheduled trainer at my company's conference. And it's been a while since I talked about this, guys. And I noticed something was wrong when I was at that conference, and I just couldn't formulate sentences. I had my notes in front of me, and it just was a hot mess, or at least in my opinion. It wasn't up to my standards. And I came home, and it was just crazy. Like, my mind, I couldn't formulate these sentences at all. Like, exactly what I'm doing right now, I couldn't even do. And I started spiking fevers, really high fevers. The highest one we recorded was 108. Yes, 108. It was crazy. Of course, I went to the ER, and they took care of that because that was really dangerous. But they couldn't figure out what was wrong with me. And I went to doctors and specialists. I went to the Mayo Clinic for 2 weeks. And, you know, I shared this with all of you guys on here. And luckily, I had a doctor that told me, he asked if I had implants, and I was like, you know, breast implants. And I'm like, well, I do. And, you know, I didn't have any problems with my implants at all. Like, they weren't bothering me. I had no pain, nothing to even correlate the two, because I was told they were very safe. And my doctor was like, you know, your lab work is very similar to other ladies that have implants, and there is this, they don't even really have a term for it yet. It's breast implant illness is what we're calling it. Basically, it's a toxicity, it's an immune response to these foreign objects in our bodies. And some people react to it and some people don't. In one way or another. Not all symptoms are the same, but the lab work's been pretty consistent with the majority of people who do have this illness. And so he said, I highly recommend you get these taken out because you're just going to continue to get worse. My symptoms were so bad that I had these crazy diagnoses, and they were giving me life expectancies of 6 to 5 years. It was a crazy whirlwind of, you know, just doctors and appointments and trying to figure out really what was going on. And once we figured out that it was possibly the implants, I immediately booked my, tried to find a doctor that was highly rated because my doctor said it was very complex surgery. It's not as easy as putting them in. It's very invasive. And you have to, you have to you have to go with someone who's really skilled, like a microsurgeon, if you will, because they're making, where my implants were, I had Allergan Natrelle Saline implants under the muscle. And what I didn't realize is that the lining is still silicone, and it does still get absorbed into your body. And where it is and where I chose to have them done, they adhered to my ribs, and that happens often with people who have them under the muscle. The scar tissue gets adhered to your rib cage. So you need a really skilled surgeon to delicately remove that so they don't puncture your lungs, right? So I was so sick at the time. This was December 2018. So I made my appointment. I tried to find the top surgeons in the area, and the ones closest to me, they couldn't get me in until August and October of 2019, and I was just too sick to wait that long. I was getting these life expectancies. I probably wouldn't live until that long. I got septic, and I was on daily injections of Rocephin, and had so many different types of antibiotics at one time. Just trying to get this infection out of my body, and they couldn't because of the implants had compromised my immune system so much. It was just, we were fighting a non-winning battle, I guess. And so eventually I found my doctor, and he could get me in right away because he saved spots for really sick patients. And it wasn't covered by insurance, and I had to fly there to Costa Rica. My doctor is amazing, well educated, and this is what he does. His expertise is in explant removals, and he's done thousands of them. So I was in such good care, and I chose because of I needed somebody to care for me 24/7 afterwards, and I'm glad I did, because having that capability to heal and be in good care to make sure nothing happened afterwards, because I was so susceptible to more infections. I had somebody watching me for 24/7. And so I did, and I ended up having some more staph infections, and I ended up staying in the hospital. I think it was about 30 some days. I forget how many exactly, but it was a long time that I was in Costa Rica. And, since then, immediate response, after, despite my infections and the complications I had afterwards, I immediately felt relief once they were removed from my body. I could breathe with no problem. I had energy out the wazoo. Like right now I have so much energy. I'm still weak just because it took a toll on my body. So once I get clearance to start able to doing small stuff, I'm going to start building my strength back up. Immediately, after I could see, I didn't have to wear my glasses. I have to wear my glasses now because some of the medication I'm on affects my eyesight. So, and it's not that bad. It's just kind of blurry. But you could also immediately see my inflammation in my body went down. If you go back and look at pictures from 2018 of me, you will see the inflammation all on my face. And right now I'm 6 months pregnant. So that's another miracle in itself. I shouldn't be pregnant right now just because of how sick I've been, the medications, and I've had so much problems. And I'm also I'm multitasking. I'm taking off my magic polish. So if y'all want to know what my magic polish is, let me know. I'll send you some magic polish too. Because that's what's paid for my many surgeries. It's been a costly mistake, but it's also made me who I am with what I've been through. And sharing my journey hopefully will help other people as well. Because that's the thing with this is you may not have any symptoms in that area, but you it could be related. And that's one thing that I didn't pinpoint unless I had an amazing doctor. And thankfully I did, because my doctor saved my life. We had, let's see, so I had a whole myriad of symptoms that have like completely vanished for the most part. I listed them here in the I guess the information about the live, so you can go and look at exactly what my symptoms were before I had them taken out. And now at the symptoms that I have now are just like hardly nothing. I still have this small vibration throughout my body, but that's probably related more now to my autoimmune diseases that I do have. I have my numbers, my lab work is continuously improving. I am very susceptible still to infections. Like I had bronchitis for like the longest time, and that wreaked havoc on my body. And so because I'm pregnant, my doctor's like, you can't do anything, you can't go anywhere. So I've missed out on some amazing trips with my company. But I'm okay. You know, I went through so much, and my health is my priority, and little baby boy to be is my number one priority too right now. But I mean, my hair is amazing. It's growing so fast. Well, you know, these are extensions, but I cut my hair afterwards because it was, I just been through so much. And now it is, see my, okay, there, this is my hair right now. It's just grown so much, and I had it cut like up to here for in July. So my hair is growing like crazy again. It's thick. It doesn't break off. My skin is amazing. I don't know if you can tell, but it also could be pregnancy hormones glowing. But I really like my skin right now. I'm also using a really good skincare line. I'm gonna host a party for that one if y'all want to know that one for a friend of mine. But my inflammation, I've not gained a lot of weight. I've lost it. I've lost so much. It just drops, and I'm not doing anything. Again, I can't work out yet. I can't even do, you know, walk. I haven't even been given permission to really walk yet. So, you know, just basically eating, and I'm pregnant, so I want anything and everything. I'm trying to eat healthier, but, you know, it is what it is. But I don't have the problems breathing like I used to either. It's like that weight and has been lifted off of my body, and I can just breathe. And so it'll be interesting to see when I have to have a CT scan and a lung biopsy. If the nodules are still there on my lower lungs after I have the baby. So then we'll know whether or not it's actual lung cancer, which has been proven as a side effect of implants, particularly silicone. But again, I had saline, so, but my shell lining was silicone. Things you're not told, and I'm, you know, frustrated about that, because we should be well informed when we're doing any type of surgery as that, especially, you know, the cosmetic kind. Where else am I on that? My husband's coming home with the kiddos, with the baby right now. He just took the older kids to school. I have a doctor's appointment, so he's here with me helping out. So that's another thing. I have to have a lot of doctor's appointments with this baby because of my autoimmune diseases can affect the baby and the heart. So far, it hasn't. Baby's really healthy right now, which is so shocking. It's a miracle in itself. What else can I say? My brain fog's gone away. I mean, besides the pregnancy brain fog that we get right now. I just very careful with what I put on my body and on my face. Like I use clean products now. Um, Even for like removing my nail polish here. I don't know if you saw, like I removed my nail polish. I use the stuff from Mineral Fusion. It's acetone free. It's really good for your nails. So I just use your clean products. Back to where it was. So right now, like I am doing amazing. And literally all I did was remove my implants. And then as soon as I got on a good antibiotic, my body started healing and it's continued to heal. I had my implants for over 11 years. I got to the 10-year mark and I was doing the research to have them replaced because you're supposed to have them replaced every 7 to 10 years anyway. And then I got really sick. It was just crazy how it happened. And as soon as I, got them out, I'm a different person. I've healed so much. Just the lab work alone is amazing. The inflammation markers in my blood work has went down within normal ranges. My vitamin B is perfect now. My vitamin D still has some work to do, but that will come with time. Because I had them so long, I have a long, long ways to still go for all my labs to be perfect again. I'd like to get back into running. For those of you that know me, know I love to run. It's my stress reliever, but I haven't been able to run in a few years now, and it's sad. So I'm hoping to be able to do that again, one day at a time. I think I will. I'm way as good as I'm feeling. The problem is with my diagnosis is it's so rare, some of them, that they don't really have proper studies about women that are pregnant and how they react afterwards, after they deliver the baby. So that could cause a flare up, which I have to kind of watch and see how that will be. I'm hoping not, because I feel really good and it just feels good to kind of get my life back. What else can I say? You go on here and you get nervous and you forget everything you're going to say. That's why I kind of typed everything up. But the main thing is I've improved greatly. I still have a long ways to go for everything to be perfect. But if it keeps going this way, I think it will improve totally. It was a very costly mistake for me. It was over, I think my tally is a little bit over $100,000 right now that I've had to spend on, from my original surgery, which was $6,500, to explanting, which included everything, my removal, to my hospital stay, which my situation was unique, so won't be this costly for everybody. But complications do arise and it's not always covered by insurance. Thankfully my treatments are covered because I do currently take IVIG infusions, which are amazing. It is plasma, it's antibodies to help with healing for autoimmune diseases and specifically infections like strep, because that was in my blood, it wasn't in my throat. So every time I went in to get tested, and they'd swab my throat, it would always be negative. It was because the doctor took that next step and actually tested my blood for strep that we found that culprit. And not all doctors will do that. So the best doctors I recommend finding if you are experiencing any of these crazy symptoms is a functional medicine doctor, and someone who specializes in autoimmune rheumatoid, I can't say that word, rheumatoid specialists, I don't know. Sorry. And a doctor that specializes in infectious diseases. If you have constant infections and you don't know where it's coming from and how it's getting there, they're brilliant at finding things for you. They kind of take your whole body approach and look at everything. Because we weren't born this way, there's a cause. So getting down to the cause was the main issue. So now that we've got to my cause, I'm improving greatly. Does it happen for everybody that has implants? I don't know. That's not been studied. But if you do have them and you have some weird symptoms, it wouldn't hurt to go to a functional medicine doctor to get it checked out, or a specialist to find out more, and especially look at all your labs. So just be very aware of your health if you have implants. And the most important thing is that during this journey, I've learned to really love myself. Even with my scars now, I know, I've been through a lot, and I can do anything really. This has made me a lot stronger. I'm not weak by any means. And I mean, I went to a foreign country by myself. I could have died there. Looking back, it's like, holy crap, you did it. But I was desperate, to feel better. And I took a chance and it worked. And, we can do anything we put our mind to. If you don't let the negative stuff affect you, focus on positives and loving yourself. And that's what I've learned through this journey. I've also learned who real friends are during this journey. I've been through some major things with friends, and it's been a learning point and growing, and blessing in disguise, all of it really. It's shown me who I am and what I can do. And that I have a lot to offer still, and that I'm still meant to do something in this world, and I'm going to help, and it took a lot for me to share this. It's not, easy talking about this. It's very personal, and it is a tough subject, and if somebody has them who is experiencing issues, there's a website I posted on this page here. Have them check that out and see if it even correlates to them. Just be very, very aware of their situations. But for me, I'm healing, and I'm only on a few medications. Thankfully, my insurance covers them, because my IVIG infusions, which I was telling you earlier, I'm kind of all over the place because it's so much energy I have, is my one cost treatment through the pharmacy that we use. It's $45,000 per treatment. I get them monthly, and thank goodness my insurance covers them. I have like a small deductible of $80, which is, amazing. And they're in demand. And if you are able to donate blood, plasma, please do so, because that is to make one treatment for my infusions. It takes anywhere from, I think the numbers my doctor said, 3,000 to 10,000 people to make one treatment of IVIG infusions. So it's very costly, and there needs a lot of donors to make the antibodies. So that's basically what it is plasma, but removed everything except for like the antibodies. I don't really know exactly the process, but it's a very in demand product, and it changes people's lives. There's people that are on it that need it to just breathe from their autoimmune diseases. I'm on blood thinners. That has to do with my pregnancy, and that I'm on the infusions because it's high risk for blood clots. And then I'm on Plaquenil, which is, it's a funny thing. It's a medication for malaria, but it has positive effects on people with autoimmune diseases. So that's helped me. And that's all I'm on right now. And a vitamin. I went from like tons of medication to like these 3 things. And like 2 I take daily in the daily vitamin. So I take a shot and my plaque went out and my baby vitamin. That's all I take. And then the infusions once a month. So I'm, it's just night and day difference. And the major effect was just taking these things out of my body. And I don't know about you guys, but I'm good. I'm healthy now, and I'm happy and doing well. And just thank you for being on this journey. I got this shirt too. I don't know if you guys want to see that, but it says, excuse the language, but it's like silicone free. And you can see my baby bump. I'm 6 months pregnant, so I'm doing well. So thank you for being with me on this journey. And if I have any more updates I can share with you, if you have somebody who's going through this and need somebody to talk to, I'm here for you. To send them my way, answer any questions that they have. But thank you for loving me and kind and supporting me during this journey. I really needed it, and it's such a huge blessing knowing that so many people are praying for you and thinking of you during such difficult times in our lives. But all right, guys, I'm going to let you go. That's it for me. Thank you. Love you all. Have a great day.